Who wants to go first? No one ever wants to go first. Just to introduce myself, my name's Sam Abrahams. Today is just to give you guys a little bit more information about what we do and to help people make a kind of informed decision about whether or not this kind of work is perhaps something they'd be interested in. Now, just to very briefly introduce our work, this is a quote from a colleague of ours, Eric Abuya, working out in Kenya, and he says, "Our courses can save lives, but we're a small organisation, and without the efforts of volunteers, this project would not be possible." I really like that statement from Eric there, because it kind of shows the ethos of what we're doing. Look, we're not trying to kind of go out there and quote unquote save the world, and what we're trying to do is increase the amount of people who have access to emergency health care when they need it the most. Now, as an organisation, we're an international charity that's been going for 5 years. That makes us a relatively young organisation, and yet within that time we've been delighted to have support on projects from British Medical Association, Red Cross, St John Ambulance, St Andrew's First Aid, and recently in the last couple of years the Scottish Government as well. Now, that's quite a vote of confidence to have that funding and that support from those organisations so soon, but I think it reflects how the international community feels about access to emergency care within rural environments. Now, we have a mix of both local volunteers and local staff who work in places like Tanzania, Kenya, Uganda, Malawi, and we also have international volunteers, folks like yourself who are willing to give up a little bit of time to actually head out overseas and work in partnership with some of our colleagues to kickstart first aid initiatives within areas that could benefit from that. It's not about sending endless folks from the West overseas to constantly try and do exactly the same thing. Equally, it's not about asking local communities just to rely on their own resources and do everything themselves. It's very much a partnership approach which allows us to develop some unique initiatives that can really help people on the ground. Why first aid though? Surely there are some significant public healthcare issues which are out there, and that's absolutely true. But the reason that we concentrate on first aid first and foremost is for a number of reasons. But one of those is represented by this chart here from the World Health Organization, and this is their statistics, not ours. And they show the burden of injury over the course of 1 year. And so the scale here is millions of deaths globally, and you can see on the left-hand side injury, and on the right-hand side HIV, AIDS, tuberculosis and malaria combined. That's not those issues individually, that's deaths combined. And you can add into there Zika and Ebola as well if you would like to, and we're still not even going to come close to the reality of how many folks are dying from injury every year. And this is just deaths. The reality is there is also a significant burden from what's called disability adjusted life years. That means if someone's doing a job and then they get an injury which is so bad that they're no longer able to contribute to a specific role within a community anymore, then we call that disability adjusted life years. So the amount of years that they will continue to live with that disability having some kind of impact, whether that be economic or social, on the community that that person is a member of. Now, we send people out to East and Southern Africa for around 1 month. We don't believe we can have much impact in just a week, but our syllabus lasts for between 3 and 4 weeks to be able to deliver that information to people who need it the most. So that's the aim behind what we do, and that's the kind of projects that we're involved with. Where next? Well, lots of people often struggle to get involved in the international development sector because of not having relevant experience, and it is becoming harder and harder to engage in international development work straight out of university. Now, that's understandable and that's absolutely fair. We want people to have experience, but how can they get the experience if we never give them any experience? So the aim that we're looking for with some of our work is to give people relevant experience within the international development community to be able to then take this forward to work in other areas. So just a quick list here that we've got: Save the Children, UNICEF, St Andrew's First Aid, Voluntary Service Overseas, the Scouts, Oxfam, World Health Organization. We're very, very lucky that lots of people have gone on straight from us to these organisations and attributed it, in most cases, to the fact that they've got the experience that they need from working with us over the course of their summer. Now, many of you will not go on to a career in international development, and that's absolutely fine too. It's a valid experience as a standalone program. But we would strongly encourage any of you guys that are interested to consider this side of things in regards to what you can do with your time once you leave. We also do some other programs in regards to research, in regards to development, and mobile phone access to healthcare as well. So if you don't fancy getting out overseas this year, there are some programs that you can get involved with a colleague of mine, Gon Asler, and ask him a little bit more about those opportunities to get involved in non-international placements. And finally, we would just say that occasionally folks are a little bit worried about, okay, am I going overseas to get, you know, elbow deep in blood and gore? No, is the simple answer to that. It would be particularly unsustainable if we were to say to folks, okay, look, if you're going to have an injury, guys, could you have it in the next month? Because that's when we've got people here. Our role is to provide training to allow people to be able to respond to community instances themselves. And there is no duty of care within the time that you're overseas. We are a teaching organisation rather than an organisation that's running treatment centres. You can help us by telling people about what we do. We always think it is remarkable that folks have heard about us. It is not something where there is a huge amount of public awareness, and that is something that you guys can very much contribute to if you're on social media and elsewhere. Thank you very much for giving us your time during this lunch break, and I'll take your questions now. Thank you.
Thanks for watching this video. Please subscribe to our channel. If you want to know more about First Aid Africa, just click up here. If you want to watch more of our videos, just click up here. If you want to help us do better, please click here to donate, and or click here if you're interested in volunteering. Thanks for watching.